Okay, today's video is tips for pain-free aging. I'm only 35, but as a physical therapist, I see people of all ages and activity levels that come through. So I have a pretty good understanding on what keeps people healthy for a while. And also, how many 35-year-olds do you know that wake up every day without back pain? Because I can say most of the days that's the case. So the first key is to find what system works best for you. There's different forms of exercise, obviously, so you want to find what you actually enjoy because the only exercise that matters is the one that you'll do. Movement really is medicine, like the body was designed to move. So whatever you can find that you enjoy doing that keeps you active is going to be super important. The other thing that I see often in the clinic is like the old saying, an ounce of prevention is worth a pound of cure. It's important to know when to stop. If you're doing an exercise and you're feeling some pain, then you push through and then you keep pushing through. Now 6 months later, you have an injury that's going to take 3 months to heal versus if you just stopped ahead of time, you can get back in maybe a week or two. So knowing when to push it and when not to push it is a pretty important key. The other step along that line is know when to get things checked. I see people all the time who have back pain and they just deal with it for 6 months, 2 years, and then they want to know why it hasn't gotten better after a couple weeks, because all these habits that you formed over this time, which led to the pain in the first place, you have to kind of rewrite that. So if you're feeling some pains, feeling some discomforts, get it checked out sooner than later, because that will just help you out in the long run. The other simple thing is just to eat well and get good sleep. Has no relation to me cooking right now. It's just easier to chat while I'm doing something. But finding a diet, again, that's best for you. There's not a one-size-fits-all diet, but if you can find foods that make you feel good, whether that's more carbs, more fats, more proteins, your body needs protein to keep your immune system strong, to keep the bones healthy. Carbs are good for just energy level, and glucose is important for the brain. But everyone's body's gonna have like a different level that's best for them. So test things out. There's not a one size fits all. Find what works best for you. Then along those lines too is listening to your body. So whether it's finding the right diet that's best, finding the right exercise, finding the time of day that's best too, because some people do well working out in the morning, some people do better working out in the evening. If you have kids, maybe you're not able to do one or the other, but there's always going to be some time in the day. Like you maybe just have to make time for it, but you only get one body. So it's super important to take care of it and make it a priority. Just find time that it fits into your schedule so that way you can make a habit of it. Maybe not as important as people say, but stretching and mobility, it's important, but I find way more injuries from people who are too flexible and not strong enough versus the opposite. Like if you're not strong enough, you can't move so well, you're not as likely to get injured because you're just not going to push into those positions that would cause an injury. Maybe you're a bit limited with other things, but in terms of just injury overall, you can be too flexible. So don't overdo it. Yoga is good, but don't do strictly yoga. You want to make sure you get some kind of strengthening in. But some stretching and mobility is going to be important just to keep the joints healthy. It can help decrease your risk of falls as you get older, and just generally for living better, moving better, it's important to keep a small stretching mobility routine down. Maybe most importantly though, is just finding things that keep you young, whether it's playing a sport, doing some kind of hobby that you enjoy, just going for a walk in the park. The biggest thing I see with patients is when I look like at their eyes and I can just see that there's not much life left. And then when they tell me what they do, they just sit inside all day, watch TV, and it's no wonder why they just don't enjoy life, because they're not really doing anything. The brain's not getting any activity. Your brain needs like novel stimulus to stay engaged. So if you want to stay young, stay active, it's important to do things. And there's a big correlation between pain and like your brain activity. So when your brain activity gets less, it's more likely that things are just going to ache, even though nothing is actually injured. It just hurts because the chemicals are all off. So finding things to keep you young, keep you staying moving. Stop when you start to feel any pain. and then come get checked out by a PT if you're having any issues.